Delivery day is here and we're excited. So you are going to get your dental device here in the next couple of days, and we're really excited for you. And I want to provide you with this informational video so that you can watch it on the front end, and then that way it's going to make your appointment a little bit more efficient in case there's any sort of questions or follow-ups regarding the information I'm going to provide to you. We can go over that. We'll also make sure that you get instructions that are written out for the delivery and expectations around wearing your appliance, but it's a lot of information, and so I want to just make sure that you have it. A couple of housekeeping items. Our follow-up visits that are going to take place over the next couple of months are to kind of make sure that we get to optimize your care plan. The follow-up visits can be completed either virtually on the computer or in the office. If we do have a virtual visit scheduled, please do not show up to my office, as I may not be there. I may do my virtual visits from my home, and I feel terrible if you show up. With that being said, I am happy to see you at any point in office for an adjustment or a visit. You just need to let me know about that. The other thing is, on a virtual visit, please do not get on the computer and tell me that your appliance hurts and you're not wearing it, because there's nothing that I can do for you on the computer. Okay, so if you're having something that's becoming a barrier for you to be successful and wear your appliance, I would so much rather have you call me and I see you quickly than have you go several weeks being frustrated with the process. Most any of the side effects or complications, should be pretty minor or go away with a little bit of time. But if you really are not willing to put the appliance in for whatever reason, I need to see you in my office so we can address that. Okay, so that's the first thing to make note of. Secondly, your appliance is designed to fit your mouth, and it is designed to be tight. Okay, if the appliances are not tight, they don't work. So if you ever experience braces, it's very similar to the sensation when the braces got tight in the first days. It's a little bit tender or achy, okay? Within a few days of wearing it, that should go away. Within a few minutes of it being in your mouth or a few minutes of taking out of your mouth, any sort of achy tenderness should go away. If, I fight a lot more with appliances that are too loose because they're not very effective than we do with appliances that are too tight. So please be aware that, the first day you take your appliance home is as tight as it's ever gonna be. It will loosen up. I can make it looser. It's hard to make it tighter. So we kind of want it on the end, Goldilocks spectrum, err on the side of almost uncomfortable, but it shouldn't be painful. Okay, nothing should create pain. Some mild discomfort, a 3 out of 10 on the scale is normal. If you need to take some ibuprofen or Tylenol the first few days, that's okay. Additionally, we don't want this to be a stressful experience for you. So if you're feeling like you need to just wear your appliance, for a few hours in the afternoon or the evening before going to bed, that's okay. Okay, so just, get used to the feel of it, get used to wearing it. That has to come first. Okay, so your very first goal by our first follow-up visit, which takes place a couple weeks later, is that I just need you to be wearing the appliance comfortably through the night. Okay, if you make it 4 hours the first night, then try again the next night, and then the more that you continue to wear it, the better it's going to be. So comfort and compliance is key first, okay? If something is not comfortable, we must address that. I need to get you wearing it all the way through the night. Even myself, with my appliance, when I first started wearing it, it took me 2 weeks before I was comfortable tolerating it. So that's okay, just have a little patience with yourself. And if you don't experience the best night's sleep of your life on the first night you take it home, that's okay, just be patient. After you are comfortably wearing it, then we're gonna start to look for subjective improvement in your sleep quality. And what I mean by that is I need you to provide me as much feedback as you can, okay? So I know that you're unconscious, and but we have a lot of ways to kind of get data on what's going on with your sleep. If you come to me and tell me, I think my appliance is fine, then I'm going to assume it's fine. So if you provide me with more information, then I can better optimize you and fine tune you more quickly. So rely on your partner, right? Snoring is the big symptom that everybody is looking for. And so if we can turn your snoring off, that's usually a pretty good indicator. There are some very good apps available on your phones that will pick up snoring. So SnoreLab is a good one. Shut Eye, Do I Snore? If you just type in snoring in the App Store, a whole bunch of things are going to come up. What the snoring apps do is it allows you to sleep unencumbered. You can sleep however you want. It's just going to pick up noise in the room. So if you have a partner that snores, do it by yourself, right? Or a white noise machine or things that can kind of skew the data, but it can give us a little bit of feedback on your noise. Additionally, you can use, smart trackers, smart watches, Fitbits, Whoops, Rings, smart beds. All of those things are going to give me information, and that can be very helpful. So that's one way to provide feedback. If you just keep a very simple kind of log or a journal, if you present me with a whole bunch of information that's all over the map, I have no idea. So just, make some simple notes on what's kind of going on. That's one way. And then also we want to go with how you feel, right? And so everybody's symptoms are a little different. It could be, you're experiencing more dreaming. It could be that you're waking up less frequently for disturbances or bathroom breaks. It could be that you have more energy throughout the day, or you're not waking up with a headache in the morning. So the kind of combination of all of the symptoms and feedback that you presented to me on your workup visit is what we're trying to tackle. So rely on your partner, think about how you feel with and without the appliance, and then let me know, okay? Once you've started to provide me with some feedback, then I may make recommendations on adjusting you, okay? So there's a couple of different ways that we would adjust the appliance, and every appliance adjusts differently. So we'll provide you with instructions on how your appliance adjusts, and we also can give you a video too if you need that. But when we're adjusting it, okay, the goal is not to move your jaw as far forward as it can go, okay? It's not to turn you into Jay Leno. The goal is to move you as minimally far forward as you need, okay? The way the appliance works, remember, is by supporting the jaw, we're keeping the tongue out of the airway. The teeth anchor, but it's about the jaw position, okay? So some people we're gonna require more movement forward, and some people require less movement forward. Compare it to a CPAP machine. CPAP, some people need a lot of pressure to make it effective. The dental device, some people need a lot of movement. You may not ever move your appliance at all, and I will help guide that adjustment. But if you're still experiencing symptoms like snoring, like poor sleep quality, like poor data on your trackers, we need to adjust you to get you breathing better, okay? So think again, like the Goldilocks effect, far enough forward. A good rule of thumb would be that if we start adjusting you, we're gonna start to adjust you 0.5 to 1 millimeter forward based on your specific appliance every 4 or 5 days based on your symptoms. Okay, we never want to adjust you to a position that's uncomfortable. That's not the goal. And sometimes if we adjust you too far, we can overdo it. Really, the airway is kind of stretching out like a rubber band. And in some situations, if I pull too far, then it kind of starts to shut and collapse back on itself. So it's about finding that kind of happy medium. You may notice with each adjustment, it feels a little bit tighter, but it's kind of like a stretch, right? So the first day you stretch, it's tight, and then every day thereafter, it gets a little bit better to the point where your body just gets kind of used to that movement without too much issue. But we don't want to go too far too fast, and that can be uncomfortable. And we want to make sure that once we find that position that's working for you, that's where we stop. So that's part of the plan. Another thing to consider is that in addition to managing your jaw in this kind of horizontal movement, we're also managing you vertically, okay? So if your mouth is having a tendency to want to fall open, that's going to be a little bit less effective, okay? So if you can imagine, here's your upper teeth, and here's your lower teeth, and here's your tongue. When your mouth is falling open, your tongue is going to kind of drift up into a little bit less favorable spot, and that can be less effective. And so for some people, it's all about just kind of making sure that the jaw is kind of staying closed and neutral. We don't want you clenching down, that can cause discomfort in the muscles, but we want your lips closed. That's going to be more effective and more comfortable. So all of the appliances have some ability to put rubber bands on them. And a rubber band is going to go kind of one on each side, and I'll show you how it works with your device. But the rubber bands are basically just going to encourage the mouth to stay closed. And typically with a rubber band, if that's benefiting you, we would replace it every 3 or 4 days if they start to stretch out. And some people, we even double them up if that makes it more effective. With the rubber bands, I'm going to recommend you put them on outside of your mouth and then put your appliance into your mouth, okay? If the rubber bands don't serve you, but we still need to keep your lips closed, for some people, myself included, I use a lip tape, okay? So there is mouth-specific tape. It is not claustrophobic, it's porous, it's not overly sticky or adhesive, but the lip tape will just kind of encourage the lips to stay sealed, and that can help also with the sensation of dryness that some people experience. And so I find that to be very beneficial for myself, and so that's something you may experiment with. I believe that the nose, a functioning nose, is very important, right? Imagine your nose being a garden hose, and if your nose is plugged up, it's like putting your thumb on the garden hose. The pressure, the water still comes out, but the pressure is higher. And so the more that you can encourage your nose to be as open as it is for you, the better you're going to be, right? Get your thumb off the garden hose and get your nose working, okay? That organ is designed to breathe. We want you to use it. So if that means pre-bed saline sprays, you spray both sides, blow your nose, spray, or a humidifier or allergy, decongestants, that can be very helpful. If your nose is really blocked and we just can't get it open, then we need to talk to ENT. But if you'll feel and find that when you're sick and congested, these appliances are not as comfortable. You can mouth breathe, but we want you to nose breathe. So, keeping the vertical of the jaw closure is as important as pulling the jaw out forward to get you breathing better. So just please keep that in mind as we're going through this. Now, some people have, other dryness issues, and in those situations, there is a product called Biotene. They make mouthwashes and jellies that you can use. You can put a little bit of Biotene jelly into your tray, and that can help, just give you a better lubricated sensation, or use the mouthwash before you go to bed. So some of those things can be, beneficial. If you feel like you're drooling a lot, that typically gets better. But if all of these things aren't helping, then, sometimes we could adjust your appliance and just allow things to close down more if you need to, right? So remember, if something is preventing you from wearing it because it's too tight, if something is painful, or if you're having a side effect, let me know. A lot of times it's very easy and simple for me to make corrections and modifications to make it better for you and make it more comfortable. So that's purposefully why we're doing follow-up, so that I can get this feedback from you. Now, the way that you take care of your appliance is you must clean it every day. Please clean it every day as soon as you take it out of your mouth. The best way to clean it is using liquid soap on a toothbrush. Scrub all the components, inside, outside. If you have a metal bar, scrub around the bar. Clean it like you're cleaning a dish. Clean it very well and rinse it off. If you are strongly opposed to the idea of soap, then you can use a denture cleaner like Retainer Bright, Polydent, Efferdent. You soak it for 10 minutes, but you still need to scrub it, or it will still get this buildup on it that's kind of unsightly. I don't recommend soaking your appliance all day. Just allow it to fully air dry. If it stays damp, it will smell, and it doesn't smell very good. The only appliances I encourage people to soak are ones that are white. If you have a white nylon material appliance, I'll tell you about that, and I want you to soak that in a retainer solution. It'll help keep it white looking and not yellow. So that's a couple of things about cleaning, but do not use mouthwash, no toothpaste. That can void the warranty, okay? These appliances come with a 3-year lab manufacturing warranty. To be clear, that is only for lab-related defects. If a bar breaks, that's a lab defect. If you break it, that's your fault, okay? So you please be careful, because some things, not every break, not every fit problem falls under this lab warranty, and sometimes it would be your responsibility to replace your appliance if you don't take care of it. The biggest problem we have is dogs, okay? If you have a dog, trust me when I say they will chew these up. Even if you think you can trust your dog, it happens all the time. We have an additional extended warranty that some people have, or you can purchase, and that would cover a dog problem, but otherwise keep it out of reach of your dog. Also, it gets lost in travel a lot, okay? People like these for travel. So we're giving you a carrying case. Put your name and phone number on that, okay? Keep it in your carry-on bag and make sure you take it with you, because those are the 2 things we get every month. A dog chewed up my appliance, or I left it in a hotel room and I'm sad. So take care of that, okay? Now, the last thing we need to talk about, which is your bite. Okay, now the bite change is the big side effect that everybody is concerned about, and I think it is possible to minimize that side effect with a few simple instructions. Okay, I'm going to give you your teeth. I need you to keep these. Okay, we keep these for a lot of reasons. If we have a lab issue, I need them. If you're experiencing some sort of bite change or problem, I need them. If I need to make an adjustment, I need them. So bring everything with you to follow up just in case. And then once I'm giving you, on a longer term recall, you can store them. But then if, we get a couple years down the road and you tell me, I think I'm having a bite change problem, we're going to want to reference this in addition to the digital molds that you have. Okay. So there are 2 ways your bite can change. First is that your bite can change with the teeth themselves wanting to tip, right? So you could get a space where a contact is wanting to open up and you're getting food stuck or something like that, that's outside of you getting new dentistry. In those situations, you could use these models to make retainers. These appliances fit tight like a retainer. They are not retainers, okay? So if you have a history of Invisalign or braces and you're really concerned about where the teeth are positioned, I would encourage you to wear your retainers during the day, okay? It doesn't have to be all day, every day, but maybe for an hour in the evening or in the morning when you first wake up, just to make sure your teeth are kind of staying where they need to be. The more common way we see bite change is full body movement change, okay? So just for imagine your back teeth right now, they touch together. You can see and feel that, okay? Now, if you slide your jaw forward just a little bit, look at what happens. Your back teeth aren't touching together. That's different, okay? So every day that you take your appliance out in the morning, you're going to experience a temporary bite change. Your bite is temporarily different, okay? And it is your responsibility to get your back teeth back together. Back teeth back together, okay? It happens on its own, and the most common way that you're gonna do that is you take your appliance out, you start your day, okay? Gentle opening, you may wanna kind of yawn or chew, talking. That's gonna start to kind of warm up the body, warm up the jaw, and start to get things kind of wanting to rebound. So you have now a nighttime breathing bite and a daytime chewing bite. You must transition between the two, okay? And so it is not a hard thing, but you just need to be mindful of it. So some of the stretching exercises that you can do is you can, like I said, open wide with a kind of a gentle resistance. You can also move your jaw sideways and other ways. Those kind of side to side and opening movements are helpful. One thing that I like to do is, if it feels a little stiff or tight, you can do a little self massage, or you can get your thumb inside your mouth along the top and the back. You'll feel like a tight band of tissue, and you're going to kind of push outwards and kind of grab the muscle. That'll relax and loosen up the muscle that's being contracted. So kind of like this. That is a gentle kind of stretch. Another great one is the thinker for the jaw. Okay, so this one basically, you're gonna rest your elbows on the counter and then you're gonna rest your chin in your hand. The goal is the angle is going back and up to the ear. You're not pushing straight back, you're not pushing straight up. So we want you to let your jaw kind of gape open, then you rest your elbow on the counter, and the weight of your head is gonna push the jaw back, okay? So those are all gentle ways to encourage the bite coming back. Okay, just imagine if you were to rest your elbow, your arm on the table for 7 hours, the muscle of your bicep is being contracted. You could do that, it wouldn't hurt, but after you remove it from the table, you need to just kind of relax it back. So it's the same kind of thing, is that your jaw's been splinted forward, and so you just are rebounding it backwards, okay? Secondarily, I'm going to be making you the AM aligner or morning repositioner. It is molded on your lower teeth, and this is an active way to reset your bite, okay? The aligner may be a different color, but it's gonna go on the lower teeth, and it's going to function like a puzzle piece to reset you backwards, okay? So you use it as a gentle chew piece and gently pull until the bite comes back together and reconnects and the back teeth come back together. With this aligner, do not put it in your mouth first thing when you wake up and jam your teeth into it. You can very easily kind of sprain or hurt your jaw, and then that's very uncomfortable. So just be gentle, and it doesn't need to take all day. You don't need to worry about it all day. You just need to kind of feel that the connection returns, and then you're okay. If you cannot get your teeth to come back together for a couple of days, or you're experiencing pain, you need to call me so that I can look and address that. So keep all of these things in mind. Keep a log of what's going on. Again, comfort and compliance. And then we're gonna look at your sleep quality. I look forward to giving you your appliance, and we'll see how it goes.